We are back with a question to our Verify team. A viewer emailed asking what metrics will determine when the pandemic is over. Is there a data target of sorts? A lot of you have wondered, when will we know when it is really over? Verify's Matt Gregory now with the answer.
We got this question in an email from a viewer. What metrics will determine when the pandemic is over? Is there a data target of sorts? So let's verify. Is there a way to tell when a pandemic is over? Our sources are Dr. Stephen Kisler with the Harvard T.H. Chan School of Public Health and Dr. Linda Naba, an infectious diseases expert. Both of our experts agree there is a way to measure if a pandemic is ending.
Pandemics don't end in a bang, but in a whimper.
Dr. Kisler explained there are two ways for a pandemic to end. One way, there's no more COVID. The virus just stops spreading. But that one is unlikely.
What I think we'll be looking for is something where COVID poses a similar risk on the population level as other things that we're familiar with. Flu is another really good example here, where we have enough people vaccinated, where we've especially vaccinated the most vulnerable to severe infection, to severe disease and death.
Dr. Naba agrees and says there are a few metrics to look at.
Infection rate, hospitalizations, and deaths are sort of the three major endpoints we look at, in addition to what we've talked about before is herd immunity.
But both of our experts say the end of the pandemic may not be the same everywhere in the world. For example, tuberculosis kills roughly 1.5 million people every year. It's an epidemic in certain parts of the world, but not here in the United States.
I think that may be what we transition into, where under some definitions, SARS-CoV-2 will continue to be a pandemic.
So yes, we do have a way to measure the end of a pandemic. It's when infections, hospitalizations, and deaths go down to a small number. However, the end could depend on where you live in the world.